Hi, I'm Luke O'Neill and here I am in my lab in the Trinity Biomedical Sciences Institute. So this week on our Covid-19 update, a few disturbing stories I guess. So first of all, Marseille, city in France, as you all know. Case numbers rising in France and Spain the whole time. Marseille is really worried. They've reached capacity in the ICU. Now they have many more ICU beds than we do. In Dublin, for example, they're all very worried there. The immediate knock-on effect is they've cancelled all elective surgery. Every other medical condition is now on hold because the hospitals are getting overwhelmed. We don't want that to happen in Ireland. We have to learn from places like Marseille. And then of course the big question is in Ireland, should we go to level 5? That's happening in many cities all over Europe. In Madrid, in Paris, in Athens, effectively they've moved to what we would call level 5 here. Bars are closing, lots of restrictions in place. Again, because they're a few weeks ahead of us. They know in these countries that as soon as cases rise, it's almost like a mathematical equation, you will get more people in hospital, more in the ICU and more deaths. I know for a fact that the Dublin hospitals, they're all worried, they're waiting for this storm now because the big fear is this increase in cases that we can all see may give rise to more hospital admissions and more problems, and that's what's happening all over Europe. And we've more information all the time on one of the big questions in COVID, can you get reinfected? Now, if it's possible to get reinfected, that changes everything. That means we can't get to herd immunity, for example. Allowing this to spread in the community will be a very foolish thing to do because you won't get protection anyway. And about 20 cases now have been analysed very closely. Some definitely get reinfected. And one worrying one was there was a person in India who had high levels of antibodies in her system and she still got reinfected. Now that's a concern. And the negative there is that maybe the virus damages your immune system. So first time you have it, you get damage to your immune system and that makes you at risk the second time around. A thing called antibody-dependent enhancement might happen where your own antibodies work against you and promote infection. Now we still don't know, no need to be alarmed as yet. It's very much a work in progress. This remains a big unknown. If you've been infected, is there a risk of reinfection? We must keep a very close eye on that scientific question. And as ever, you can hear about these stories and more on my update on COVID-19 with Pat Kenny on Newstalk.